Today we're going to start very important topic of medical emergency. One of the most important. It can happen to anyone in the clinic hospital. So let's start it. Number one. Bismillahirrahmanirrahim. Okay, so number one, what we're going to do, the management of a patient with a history of angina pectoris. So basically, with the patient has a history of angina pectoris. So number one, you will consult the patient physician. Very important point, and use an anxiety reduction protocol. Very so before the night before the dental appointment, so you must assure that the patient has a good sleep. Give a diazepam basically to the patient. Okay, give some pre-medication in like anxiety reduction medication you can give to the patient. Okay, basically the patient the appointment should be at the morning time. Basically the appointment should be not too long. Have a continuous verbal contact to the patient, so the patient you can the patient does not focus on the treatment, and you can distract the patient from the treatment procedure. Actually give a relaxing background music to the patient. Okay, and also basically reassure the patient basically continuously. Okay, then okay, number one, you will give the nitroglycerine. Nitroglycerine is very important drug which can be if the patient has a sudden angina, so you can give some sublingually nitroglycerine to the patient if it is indicated. So give a pre-medication. Use a profound local anesthesia before starting a procedure. Use nitrous oxide as a sedation, and basically monitor the vital sign continuously. Okay, limit the amount of epinephrine to the point zero 4 milligram maximum, because we all know that epinephrine is a vasoconstrictor and it increases the heart rate, and it basically put load on the heart. Always remember give in a small amount, and basically maintain a verbal contact with the patient throughout the procedure to monitor the status. Okay, number second is myocardial infarction. How will you manage the patient with the myocardial infarction? Always remember that the patient of myocardial infarction, you should always consult the physician. This is very, very important. Without the consent of physician, in this case, do not start a procedure. And if the patient has a history of 6 months before the of the myocardial infarction, so you should ensure that you should basically take consult from the physician. Very important. Now always remember from this type of patient you should take the history of their drugs. The drug history is very important in this patient. If the patient is taking aspirin, okay, so always remember that aspirin is a blood thinner. If you do any procedure and there's a prick and sudden bleeding is started, so it's very important you should take it. Then anxiety reduction protocol, which I have told you, also have a nitroglycine available. Very important as a prophylactically if the patient advises. Give oxygen supplements. Use a profound local anesthesia like nitrous oxide sedation. Monitor the vital signs. Maintain the verbal contact. Epinephrine 0.04 milligram always use, and also refer the patient to the oral maxillofacial surgeon. Okay, okay, so how will you basically if you have a patient, how will you actually now manage manage always remember terminate the all dental treatment. You are doing any procedure, terminate it on that position. Okay, position patient is semi reclined posture. It's very important that the patient in this you should use it semi reclined posture. Semi reclined is basically like this little bit. Okay, use nitroglycerine, which is zero point 0.4 milligram tablet or spray. Give an oxygen, and also check vital signs like pulse rate or blood pressure. Okay, assume that angina pectoris is occur. Basically, if the patient has angina, so what you will do, you will slowly taper the oxygen over the 5 months. Okay, 5 minutes, and then modify the dental treatment to prevent the reoccurrence. So what you will do some modification in your dental treatment. Okay, okay, to relieve the patient. Take a discomfort when the is relieved. Okay, now if the discomfort is continue, 3 months after the nitroglycerin first dose. You have given the first dose basically, and then there's no relief. So what you will give, you will give the second dose. Then monitor the vital signs again, and after the second dose, if the patient matlab, no relieved, so you will give the, so what you will do, you will give the third dose of nitroglycerin. Monitor the vital signs, and and basically have someone medical assistance. Very important point. Okay. Then if the discomfort is relieved, so refer the patient to the medical evaluation and before the further dental care. But if the discomfort, so what happens if the discomfort still continues basically after the third dose of nitroglycerin? So always assume this is a myocardial infarction after the angina. So if patient has angina and it leads to now myocardial infarction, so administer the 352 milligram of aspirin. Very important point. Okay. Start IV line with a drip of crystallized solution. First you will give like 350 milligram aspirin, then give a crystallized solution of 30 milliliter per hour. In severe discomfort, titrate morphine sulfate 2 milligrams subcutaneously or IV every 3 minutes until the patient is not relieved. Prepare the transport emergency care facility. Give basic life support if necessary. Okay. Number one point that the if the blood pressure is over falls between 60 is systolic and 50 is diastolic, so without nitroglycerin and morphine sulfate, and call or wait for arrival of medical assistance. So very important point basically, if the patient has an angina pectoris, so number one, stop all the dental treatment. Number two, put her a semi reclined position. Okay, give a nitroglycerin zero point 0.4 milligram. Okay, then check the vital signs. Number first give first dose. Now if the patient is not relieved, if the patient is relieved, so basically you will say this is now angina pectoris, then you will slowly give the oxygen and modify your treatment and you will start again. But if after the first dose still the patient does not have relief, so always give the second dose. Monitor the vital signs, still the patient does discomfort, so give the third dose and monitor the vital signs, and have someone medical assistance. ठीक है. Basically, if after the third dose patient is not relief, you should consider this is a myocardial infarction. You should give the aspirin 352 milligram. Then you should give the crystalloid solution which is 100 milliliter per hour. Give titrate morphine sulfate 2 milligram subcutaneously or IV. Okay, and prepare and next point is just hospitalization, transport emergency, and basically give basic life support.